Greetings, I'm Dr. Bryn Austin, founding director of Striped, a public health incubator based at Harvard and Boston Children's Hospital in the US. I am delighted to share this highlights reel on our strategy for impact and our global Striped community.
Introducing Striped. Our mission is to train the next generation of health professionals to harness the power of public health to prevent eating disorders and related problems with food, weight, and appearance. We strive to create a society where girls and boys and people of all genders can grow up at home in their own bodies. Why Striped? Well, 9% of the US population, or 30 million Americans, will have an eating disorder within their lifetime. This field is historically underfunded and prevention is overlooked, which is where Striped comes in. Step 1 is training. We train the next generation of leaders with graduate students, fellows, and early career scholars, and our policy translation team, which is consisted of youth advocates. Here's what one of our visiting scholars, Katrine, has to say about her experience with Striped.
I'm Katrine Bunderland Tilbo, a PhD candidate from Aarhus University in Denmark and a visiting fellow at Striped. My work explores how social media impact youth mental health. For instance, influencers who feel like peers can intensify negative self-comparisons. Striped has shown me how data-driven insights can help shape smarter, more equitable public policy for the next generation.
Then comes research. We bring together experts in eating disorders, public health, adolescent preventative medicine, health law, policy, and economics to create a public health incubator where transdisciplinary collaborations spark innovative, cross-cutting approaches to eating disorders prevention, and we even create tools to make this research easier. We've also created working groups. For example, the Eating Disorders Public Health Surveillance Working Group is focused on improving eating disorder surveillance in the CDC's YRBS. We also collaborate with economists and decision scientists to generate economic evidence showing why prevention makes sense, ethically and financially. Our landmark reports have documented the cost of eating disorders to the U.S. economy, the cost of body dissatisfaction, and the cost of discrimination based on weight and skin shade. We've also modeled the potential cost savings of prevention strategies, including age restrictions on toxic over-the-counter diet pills. Scan the QR codes to explore more about our fact sheets and state-level data. Next, we translate our research into action. We work with lawmakers nationwide with policies to protect youth health. Our two major campaigns are the Out of Kids' Hands campaign and the Social Media Accountability Act. Across the country, over-the-counter diet pills and muscle-building supplements are sold freely. No age limits, little oversight, and serious risks. These products can fuel eating disorders and worsen health inequities. Thanks to the work of our advocates and partner organizations with the Out of Kids' Hands campaign, multiple states have introduced our model legislation. And in New York, our model legislation was passed into law in 2023 to protect their young people. And in Massachusetts, Striped gathered at the State House for an advocacy day and legislative briefing, sharing our fact sheets to support the Out of Kids' Hands campaign and to advance this vital child health legislation. Social media influencer Allie Evans even testified before the California State Legislature, sharing her story and calling for stronger protections for young people.
These products are not just accessible to children, but they are strategically marketed and targeted to kids by adults. California's kids deserve the opportunity to enjoy their childhoods without being targeted by weight loss brands. Legislation is needed to protect kids because the brands behind these supplements have no plans to stop targeting our kids with manipulative and misleading marketing. And for that reason, I'm urging you to pass Assembly Bill 82.
Social media can be both a resource and a risk for youth. Deceptive design features can harm mental health. Stripe's model bill, guides, and roadmap for algorithm audits promote transparency, all to build safer, healthier digital spaces for young people. In Massachusetts, Striped and social media law experts testified in support of Senate Bill 51, calling for independent audits of social media algorithms to protect young people's mental health. Our research is even shaping national policy, with Senator Amy Klobuchar citing Stripe's study in Congress to support stronger algorithm accountability.
According to a recent study, social media platforms generated $11 billion in revenue in 2022 from advertising directed at kids and teens, including nearly $2 billion in ad profits derived from users aged 12 and under.
We're honored to welcome our newest members to our International Expert Advisory Panel, Drs. Trine Tetley-Eiknes, Emilio Compti, Laura Hart, M. Bromberg, and Suk-Ning Chua, all world-renowned scholars in eating disorders prevention and public health. They will join longtime member Deborah Franco to help guide Stripe's next decade of innovation.
Hi everyone, I'm Dr. Suk-Ning Chua from Relate Malaysia, and I'm honored and delighted to be part of the Striped International Expert Advisory Panel. Relate Malaysia has been collaborating with Stripe on projects across Asia, including research on eating disorders and body image. And I'm so excited to see how our collective work will shape the future of mental health and body image research across the region. I'm so grateful to be part of the team.
At Striped, we combine training, discovery, and policy change, mentoring future prevention leaders, advancing cutting-edge research, and turning evidence into laws that protect youth. Together, we're advancing prevention one project and policy at a time. We'd also love to wish CoRe-ED a very happy birthday. Thank you so much for watching. Check us out on our website using the QR code attached.